the intercostal nerve and vessels and internal thoracic artery. So in this we discuss the competency, that is course relations branches of a typical intercostal nerve. Intercostal nerve block is a useful procedure for relieving and defining potential sources of pain in the chest and abdominal wall. Intercostal nerve block at the posterior axillary line relieves pain of somatic origin. Intercostal nerves are ventral rami of thoracic nerves T1 through T11. The 12th ventral ramus is called a subcostal nerve. It provides preganglionic sympathetic fibers and receives postganglionic fibers. Gray rami join the spinal nerves near their exit from the intervertebral foramen. A short distance beyond the intervertebral foramina, the nerve roots divides into posterior and anterior primary divisions. Posterior division carries sensory and motors fibers to the back. The posterior cutaneous and muscular tissues which are paravertebral. Antedivision. Antedivision becomes the intercostal nerve. It gives rise to lateral cutaneous branch just anterior to mid-axillary line, which sends subcutaneous fibers both anteriorly and posteriorly. It continues as anterior trunk. It terminates as anterior cutaneous branch. Collateral branch runs inferiorly to the main nerve on the upper border of rib below. Together they give off numerous muscular branches. Each intercostal nerve enters the intercostal space. It runs forwards inferior to the intercostal vessels in the costal groove of the corresponding rib. First 6 nerves are distributed within their intercostal spaces. 7th to 9th intercostal nerves leave the anterior ends to enter the anterior abdominal wall. 10th and 11th nerves pass directly into the abdominal wall. Lower intercostal nerves, that is from 7 to 11, supply the skin of the abdomen. These nerves supply the muscles of abdomen, leading to the tickling response. Anterior division of the first thoracic nerve divides into large superior part and small inferior part. Superior part joins the brachial plexus. Inferior part becomes the first intercostal nerve. It usually gives off no lateral cutaneous branch. Second intercostal nerve may also contribute a small branch to the brachial plexus. Lateral cutaneous branch of the second intercostal nerve is called as intercostobrachial nerve because it supplies the floor of the axilla and then communicates with the medial cutaneous nerve of the arm to supply the medial side of upper limb as far as elbow. Then we go to study the anterior and posterior intercostal vessels and internal thoracic arteries. Anterior intercostal arteries. 1 to 6 anterior intercostal arteries arise directly from internal thoracic artery. 7 to 9 arise from musculophrenic artery. In each intercostal space, the anterior intercostal artery divides into paired branches. Large main branch course laterally in the upper aspect of the respective intercostal space. Smaller collateral branch descends into lower aspect of its respective intercostal space and courses laterally. In the two most inferior intercostal spaces, that is 10th and 11th, anterior intercostal artery is absent and the posterior intercostal artery supplies each space solely. Branches of anterior intercostal artery. It gives off various number of small perforating cutaneous branches and anastomose with branches of the posterior intercostal artery. Area of supply. Along with the posterior intercostal arteries, the anterior intercostal artery supply the muscles of and skin within the intercostal spaces as well as the parietal pleura. Posterior intercostal artery, it lies within the costal groove. However, in anatomical dissections, considerable variation has been seen in the position of the neurovascular bundles. It is reported to be located at a variable distance from the costal groove. Internal thoracic artery. It arises from thoracic part of subclavian artery, opposite to thyrocervical trunk. It descends on the pleural cupula to cross sternal third of the clavicle and the first rib cartilage to enter the thoracic cavity. Friedrich now joins the artery on its lateral aspect. From below the first costal cartilage, the artery descends vertically to its branching point. The artery descends posterior to costal cartilages and internal intercostal muscles. Most frequent level of termination of the artery is in the 6th intercostal space. Artery runs approximately 13 millimeters lateral to the sternal edge. Then atypical intercostal nerve, superior intercostal artery and subcostal artery. Atypical intercostal artery. Only 3 to 6 intercostal nerves are typical nerves. First, second, 7 to 11th intercostal are atypical. First, second and 7 to 11 are atypical nerves. First intercostal nerve. Regarding first intercostal nerve, Cave reported a case of lesion of first thoracic cord segment in which there was anesthesia over the distribution of T1. He confirmed as to the existence and extent of the cutaneous distribution of the first intercostal nerve. Cunningham in 1879 stated that the first intercostal, although disposed after the manner of an intercostal nerve, furnishes no lateral cutaneous branch. Bentley investigated the first intercostal nerve in the course of some research work which supported Cave's work. Atypical intercostal nerve. The second intercostal nerve gives a large cutaneous branch to the floor of axilla and the medial side of the arm called as intercostobrachial nerve. 7th to 11th intercostal nerve enter the anterior abdominal wall at the anterior ends of intercostal spaces. 10th and 11th enter directly. They run in the anterior abdominal wall to supply the skin and muscles. Superior intercostal artery. There are 12 pairs of posterior intercostal arteries. First two pairs originate from the supreme intercostal artery from the costocervical trunk of the subclavian artery. The first two pairs originate from supreme intercostal artery from the costocervical trunk of the subclavian artery. Subcostal artery. It arises from the descending aorta. It courses laterally beneath the 12th rib. They are analogous to the posterior intercostal in the subcostal space. They pass in front of the T12 vertebra, behind the sympathetic trunk, pleura and diaphragm. On the right, subcostal artery runs posterior to the thoracic duct and azygous vein. In the left, it runs posterior to accessory hemiazygous vein. Thank you.